Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're sitting down with a gastroenterologist to discuss the signs, symptoms, and treatment options for those suffering from inflammatory bowel disease.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Raya Kaplan. She's a gastroenterologist here at East Cooper Medical Center. Thanks for being here.
Thank you for having me.
Okay, today we're talking about IBD. It's inflammatory bowel disease?
Correct.
Gotcha. All right, so what is that?
So IBD, or inflammatory bowel disease, refers to a couple of conditions that can cause inflammation in the entire GI tract. So underneath inflammatory bowel disease, or IBD, is ulcerative colitis and Crohn's. So Crohn's disease can affect your colon as well as your small bowel and your upper GI tract. Ulcerative colitis only affects your colon. And it's important to distinguish IBD, which is ulcerative colitis and Crohn's, from IBS, which is irritable bowel syndrome.
That's what I was going to ask you.
Completely different disease processes, completely different long-term prognoses. So IBD refers to ulcerative colitis and Crohn's.
Yeah, because Crohn's can really wreak havoc. I've had some friends who have that. I mean, it can really do some, impact your life.
Right, so both, Crohn's, ulcerative colitis, often patients present with diarrhea, abdominal pain, weight loss, fatigue, blood in the stool, sometimes red blood, sometimes darker blood, depending on where the disease is active. Really, the symptoms can run a pretty wide range depending on how severe your colitis is. Very mild colitis, you may only have a little bit of diarrhea, vague cramping, vague pain. The other end of the spectrum, patients in the hospital with severe diarrhea, severe anemia, severe bleeding, weight loss. So,
and I always think, people don't need to live that way. They don't need to just ignore it and act like it's just a part of life. So, I mean, if they just let it go, aside from it just being a miserable way of being, are there any risk factors for what could happen if they just let it keep happening?
Right, so some of the complications with uncontrolled or severe ulcerative colitis, Crohn's, you can develop what are called strictures. If there's a lot of ongoing inflammation, it can narrow down parts of your intestine and cause blockages. You can develop perforation, which is a hole in your intestine somewhere, an abscess, infectious fluid collection associated with both of those diseases. Fistulas, where parts of the bowel become connected to other things such as your bladder, your vagina, your anal area. So those are the more immediate complications that you can get from uncontrolled disease. Long term, if you've had both ulcerative colitis or Crohn's, active over up to about 8 or 10 years, at that point there's a higher risk of it in colon cancer. So that's another aspect to the disease, is that at that point, 8 to 10 years out from initial diagnosis, particularly if you've had very active symptomatic disease, you're actually in a higher risk category for colon cancer, and we recommend screening colonoscopies every 1 to 2 years at that point.
So how much does your family history and genetics and stuff play into this kind of stuff?
Yeah, there's definitely thought to be some component. It is seen quite often within family members, but there are patients that have ulcerative colitis or Crohn's and don't have any family history. So there's some genetic component, but it's not all necessarily genetic.
Okay, so how do you treat it?
For treatment, there's various medications. They're in the acute phase. If you have sudden onset, steroids have been something that we've used. We're trying to stay away from steroids now at this point. Steroids have long-term effect in terms of bone density issues, other complications. So steroids is one option, which we try to steer away from now. There's also medications called 5-ASA, which attack the inflammation in the GI tract in a different manner, generally safer and better tolerated long-term than steroids. There's other immunosuppressants that we use to suppress the immune system from attacking itself, which is essentially what causes the inflammation in your GI tract from inflammatory bowel disease. There's newer medications, biologics. You may see commercials on TV about injections nowadays that can be used also to target the immune system and keep it from causing all the inflammation in the GI tract. So there's various remedies out there, and what we use depends on how severe your disease is.
Is surgery ever a part of that?
Surgery is,
and that's probably obviously the
very last resort. And because now there are so many options in terms of biologics, there's other newer oral therapies on the market now. Because the medical treatments have gotten better, surgery really is a last option. You may end up with surgery, in situations like a bowel obstruction from a stricture, if there's a perforation, that type of thing. But just having surgery to treat the colitis itself, whether it's Crohn's colitis or ulcerative colitis, is much less frequent nowadays.
Isn't it amazing how these advances in medicine really, are changing lives and have such an impact like that, so that now you don't have to jump to surgery, you have all these options.
Absolutely.
Alrighty, well, thank you so much for being with us, and for more information, go online to eastcoopermedctr.com.